And as more and more people get vaccinated against COVID, we're learning about potential side effects. One is swollen lymph nodes, and while this is what you'd expect to see when an immune response is triggered, it's exactly what you don't want to see when screening for breast cancer. As CBS 4 anchor Lymph Pastrana explained, that's raising some concerns.
And we're going to screen and be preventative.
Dr. Jessica Burgers is a breast surgeon specializing in hematology oncology at Holy Cross Hospital in Fort Lauderdale. She knows exactly what to look for when screening for cancer.
And one of the things that is a tip-off for cancer in the lymph nodes is to see the lymph nodes looking swollen or enlarged.
But a lot of people may be experiencing swollen or enlarged lymph nodes these days because it's a common side effect of the COVID vaccine. Dr. Burgers noticed it firsthand after she was vaccinated.
It wasn't until the second shot that I did actually experience a side effect that we are becoming more aware of, where I had some swelling and soreness in my armpit area, or what we as medical professionals call the axilla.
She says it's a normal response to a vaccine because the lymphatic system houses immune cells, and the point of the vaccine is to initiate an immune response. But swollen lymph nodes, particularly in the armpit area, can also be a sign of breast cancer.
Radiographically, these can appear very similar, and so it could be alarming for a radiologist who doesn't have the context of the fact that a patient had a recent vaccine.
She says it's an issue coming up more and more often in her own practice and could lead to an increase in false positives.
I'd say about once a week we're getting reports, and so it's prompting me that when I'm calling my patient with their imaging results, one of the first things I ask is, did you get the vaccination?
Dr. Berger says if you were recently vaccinated and otherwise healthy and not experiencing any breast concerns, try to delay your mammogram a bit. The Society of Breast Imaging recommends scheduling your mammogram either before your first dose of the COVID-19 vaccine or about 4 to 6 weeks following your second dose, if possible.
That being said, if a patient is being currently worked up for a breast complaint, something that's going on that they need a mammogram more urgently, this should not deter a woman from getting her mammogram. She just needs to make sure that she lets the doctors, the technologists at the imaging facility be aware that she had the vaccine and what arm was used for that vaccination.
Dr. Berger says if the swelling is vaccine-related, it should resolve itself within 2 months. If it doesn't, definitely follow up with your healthcare provider. Lymph Pastrana, CBS 4 This Morning.